How are you?
Good.
So you are Olivia? Great. How are you today?
Okay.
Good. It's good to know. So what brought you in today?
I have physical exam
A physical. Okay. So and you're a physical for school or for what exactly?
for school.
Ah, okay. I see. Where do you go to school?
Lomunda.
Loma Linda. Okay. And what year are you?
I'm a senior.
Okay. All right. Great. Well, what I'm gonna do is when I get ready to get started, I'm gonna ask you a few questions, and then after that, then I'm gonna do a physical exam with you. Okay? But before I get started, I want to see if you can ask you some questions after do the orientation. Can you tell me what year this is?
2019.
Great. And who is the President of the United States?
Donald Trump.
You answered the questions perfectly. All right. So can you tell me a little bit, Olivia, as far as a little bit about your medical history, such as do you have any other medical issues going on right now with you?
No.
No? Okay. Does your mom have any medical issues?
No.
Diabetes, hypertension? No? Okay. How about your father?
No.
No diabetes or hypertension?
Mm.
How about any siblings?
No.
No. Can you tell me a little bit about your grandparents by chance on your mom's side? Any diabetes or hypertension or
My grandpa.
grandpa? What does he have?
Diabetes.
Diabetes, okay. And how about on your grandparents on your father's side?
Dementia.
Dementia, okay. And do you know anything about your grandmother on your father's side?
No.
No, okay. So how about yourself? Have you had any, you said that you don't have any issues with you right now, but you're in school. Are you driving?
Mm.
You do. And when you wear a seatbelt when you're driving for the most part? Okay, that's important. Very, very important. Tell me a little bit about where you're living. Where do you live exactly?
I live in Lomunda.
You live in Loma Linda. Okay, and who you live with?
My mom.
Your mom. All right. Is there any drugs in the home? Do you
No.
smoke any drugs?
No.
Use drugs? How about
Prescription drugs?
prescription drugs? Like what?
Just like medicines and stuff.
But not illegal drugs like marijuana or
No.
okay, all right. How about any alcohol? Do you drink any alcohol at all?
No.
Okay. Have you ever had any bullying going on at school at all for you?
Yeah.
No? Okay. What are your interests, your hobbies? No.
I like listen to music and stuff.
Okay. It helps you relax a little bit. All right. That's important. That's good to know. Right. So what I'm going to do right now is I'm going to go ahead and start with the physical and ask you some more questions about yourself. So I know you're here for a physical, but have you had any problems with your head, any headaches or blurred
No.
vision? No? No headaches? How about any blurred visions? I see you have glasses, but do you have any blurred visions at all?
No.
No? Have you had any problems with your ears? Any pain or swelling or hard to hearing? No dizziness? Okay. How about with your nose? Any type of like drainage or nose
No.
pains? Nothing like that?
Mm-mm.
How about your mouth? Any problems with your teeth or anything like that?
No.
No? You've been to a dentist?
Mm-hmm.
When was the last time you had your dental appointment?
A couple months ago.
Okay. Was that clean bill of health?
Yeah.
No problem whatsoever. Okay. How about any problems that you know is with your arms, legs, or limbs?
No.
No? How about anything with swollen glands that you know is at all whatsoever?
Not really.
No? Okay. When was your last period?
Recently.
Okay. All right. Did you have any problem with your periods normally?
No.
Okay. Is it every 28 days or 21 days just about?
It's just about a month or so.
About a month, okay.
Yeah.
Have you ever had pap smear?
No.
Okay. So for the sake of this video, the OB and GYN will be deferred for that sense. Okay. And pretty much no pain or discomfort at all whatsoever?
No.
No? Okay. All right. So now I'm going to go ahead and get started with the actual physical part of the exam. And as I go through it, let me know if you have any pain or discomfort. For the sake of this video, the vitals were done prior to her coming in, and they were reviewed, and also her BMI and nutritional level was reviewed as well, which at the time Olivia's BMI was at 35.1, and for her height of 5'8" actually. So that was reviewed, and I will go over some nutritional levels at the end of this video. In addition to that, privacy has been maintained, and I did wash my hands prior to that time, so before I start my exam. So all that was done prior to her coming in. Okay, so as I'm looking at Olivia right now, I'm looking at her hair, and it looks like it's normally distributed. It looks like it's very thick and wavy, evenly distributed actually. Her head is normal cephalic No problems at all whatsoever. I don't see any scars or abrasions on her skin at all whatsoever. And then if I may, I'm gonna go ahead and touch your hair. Okay. I don't see any scabs or any lesions. I don't see any lice or anything like that in her head. Very nicely thick, moisturized very well. I'm looking at her skin. It's normal to her ethnicity. It looks like it's very moist. And when I checked her hydration, I'm looking at it. There's no tinting at all, so she's well hydrated, which is good. I'm also looking at her capillary refill. Great, that's less than 2 seconds, so that's really good too as well too. So I'm gonna move back to her face here, and if I may, Olivia, I'm gonna go ahead and lift your eyeglasses so you can go ahead and take them off just for a moment. Okay, great. And I'm gonna go ahead and look at her eyes. I'm gonna raise them up really quickly here. And I'm looking here, and her sclera is white, and her conjunctiva is pink and moist, which is what we wanna see here. And I'm also looking at her nose. Her nose looks like it's symmetrical on both sides. I don't see any drainage or anything like that coming from her nose. And I'm going to go ahead and look into your nose. I'm going to go ahead and take my spectrum and look, first of all, before I look at your nose, I'm going to go ahead and look at your eyes first. And because I want to go ahead and check our, we're going to go ahead and check all of our cranial nerves in a second, but first I just want to just visually look at Olivia beforehand. So like I said, her nose is very symmetrical. I see that her mouth also too. I don't see any cuts or abrasions in her mouth. Go ahead and open your mouth. And just looking at it, it looks like let me just glance at it real quickly before let me look. Good, it looks like it's pink and moist, good dentition. Looks like it was well taken care of in that regard. You've gone to the dentist, which is good to see. So let me go ahead and get started looking at the cranial nerves. Now, for the sake of this video, usually cranial nerve is deferred, but I want to go ahead and test Olivia's cranial nerve 1 anyway. So Olivia, I want you to go ahead and close your eyes, if I may. And then I'm going to give you a scent, and I want you to tell me what the smell is. What did you smell?
Vanilla.
And that's exactly what this is, vanilla extract. Can you open your eyes again? Okay, great. And then now I'm going to go ahead and look at cranial nerve 2. I'm checking her optic. And so what I'm going to do, first of all, Olivia, what I want you to do is I'm going to look into your eyes. And with this, I'm going to check for accommodation. And so what I want you to do is I'm going to hold on to this pin right here. And I'm going to bring it right in and see if her eyes cross, which they do. Great. So that's intact. That cranial nerve is intact as well too, which is good to know. All right, and then now what I want to do, I'm going to look into your eyes here. And I'm looking pretty much when I'm looking at Olivia's eye, I'm looking to see if there's any dyshemages or at all whatsoever. So I'm going to have you close one eye and look this eye here. Just look right at me. Open your eye. Good. I don't see any, the discs are sharp, so that optic nerve is intact, which is good to know that as well. So now I'm going to check to see if I have any extra movement with her eyes, or if her EOM is intact. So what I want you to do is look at this pin right here, and I want you just to follow it directly if you can. So I'm going to try to go this way, follow up. Great. And you're going to let me know if you see any pain or discomfort, okay? Any problems? No. Okay, so you're looking straight at it. And go this way. And I'm not looking for nystagmus. I don't see any at all whatsoever, so I don't see any extra ocular movement. So this is very good. So that looks like her cranial nerve is also intact, the 3, 4, and 6. Okay, great. Now what I want you to do, Olivia, is I want you to look straight ahead, straight here behind me. Just look straight here behind. And what I'm going to do is I'm going to look at your eye. I'm going to highlight pen. Okay? Great. And her pupils are reactive. So perla, they're reactive to light from 4 milliliters to 2 milliliters. So that's really, really good to see right there. So now I want to go ahead, at the same time right now, I want to check her peripheral. And so what I'm going to do for you right now, Olivia, is I want you, look, go ahead and stand right here. If you can stand right here. And what I want you to do is we're going to cover your right eye. So you might want to put your glasses in the other. Yeah, there you go. Cover your right eye. And this is my right eye as well too. Okay, you're covering your right eye. Mm-hmm. And I want you to tell me which fingers you see, and just look directly at me. Mm-hmm. And then I want you to tell me how many fingers do you see?
2.
Excellent. And then I want you to cover your other eye. And then I want you to tell me, look directly at me. And then I want you to tell me how many fingers you see here.
3.
Excellent, great. So I tell you, go ahead and have a seat right there. So that tells me also to the optic nerve that is also intact. Her cranial nerve is intact with that. So now what I want to go ahead and do is I was already looking. I looked already at her nose right there, and we already did the smelling test in that regard. Her optic nerve, cranial nerve 1 was intact. So now I want to go ahead and look inside your nose, if I may. And I'm looking to see if her septum is correct. If her nares are patent. So I want you to raise your head up, back, please. Okay. And we'll look in. Great. And it looks like her nares are patent. I don't see any drainage at all whatsoever. They're pink and moist, which is what we want to see completely entirely. So that's good. And then now what I want you to do, Olivia, is I want you to open your mouth again. And I'm going to check her gag reflex as well too. So you're going to say, ah, look down, ah. Her tongue is midline, a uvula is right in center. The gag reflex is there. Perfect. Let's take out your tongue. No problem. So that cranial nerve is 11 and 12 is there. I want you to puff out your cheeks. Cranial nerve 7 is there. Can you smile for me? Can you frown? There you go. So cranial nerve 7 is also intact as well too. Now I'm going to check cranial nerve 5. And what I want you to do is I'm going to put my fingers here. And I want you to open your mouth and tell me if you have any pain. Any pain?
No.
Cranial nerve 5 is also intact. That's good to see here. So we got here and looked at that as we went through your whole body that way. Now I'm going to go ahead and check her sinuses and see, have you had any problems with your sinuses before in the past? So I'm going to check her frontal, ethmoid, and maxillary. And I don't feel any puffiness at all whatsoever. And that feels like that is intact as well too. And so while I'm here, before I check into her ear, I'm going to go ahead and look right now. I'm already inspecting her ear. Just hold it, look straight, Olivia. I'm looking at her ear. I'm looking at her pinna here. Her ears are nice and symmetrical. I don't see any problems or drainage at all whatsoever or any pain. They're not red or swelling. You have no problem with the ears at all whatsoever. So I'm going to go ahead and look into your ears, Olivia. And what I'm looking for is I'm looking to see if I can see a cone of light. And I'm looking to see if your tympanic tympanic membrane, if it's gray and pearly, which is what I want to see. So I'm going to pull it up and look in. Good. See a little bit of wax, not too terribly much, but I see the cone of light is right at 5 degrees, which is what at 5 o'clock, which is where it should be, and it's pearly and gray, which is good. Now I want to go ahead and test another thing. I want to see how well this cranial nerve is to whisper. So what I want to do is I'm going to put my finger in your ear right here. Close your eyes. And I'm going to whisper right now. What did you hear?
2.
Good. And we're going this side over here. 3. What did you hear?
3.
Good. So cranial nerve 8 is also intact. So that's good to know as well too. Now what I'm going to do is I'm going to go here. And if I may, just relax. Okay, I'm just going ahead and feel right here. And what I want to do first of all, I'm going to feel and see, let's look at her lymph nodes, the submental. Do you have any pain or discomfort here? No? Okay, good. And they're non-palpable. I don't feel anything here. No, nothing palpable at all, less than 1 centimeter. Now I want you to raise your head back so I can feel your thyroid. I want you to swallow for me. Good. I don't feel any large thyroid or nothing palpable as well too. So now I'm going to check your cranial nerve 11. And I want you to shrug your shoulders for me. I resist. Good. Any pain or discomfort?
No.
Good. Okay, now I'll put my hand here and we turn your head to the opposite direction. Good. Any problems?
No.
Okay, good. Turn it this way. Awesome, good. All right, so while we're doing that, I want you to go ahead and test your range of motion. What I want you to put your head down. Good. Put your head back. Any pain or discomfort?
No.
Good. So I want you to go ahead and stand up, please, for me, if I may. Turn to the side. I'm going to test your drop arm. Take one arm out. Any pain or discomfort?
No.
Good. So I'm going to do the open can, twist. Any problems?
No.
No pain or discomfort? Okay, great. Now we're going to take and put your one arm back over here. Let me see if you scratch your back. Any problems?
No.
Let's try put this other arm this way. Any pain or discomfort?
No.
Good, no problems at all whatsoever. Okay, now I want to do the Phelan's test. I want you to put your hands right here. This is for carpal tunnel. Usually I would have it for 1 minute, but because of the fact that for time, let's take this video, keep your hands here. Do you feel any pain or tingling?
No.
Great, that's good to know. Now I want you to bend over. Do you have any pain or discomfort?
No.
Okay, come back up. Now I want you to walk on your tippy toes. Any pain or discomfort?
No.
Good. Now let's do heel toe. You come back. Great, no problem.
No.
Okay, I want you to put your shin, head to your shin. Any problems at all whatsoever?
No.
And this way, no problems at all whatsoever?
No.
Okay, great. And then what I want you to do also is bend knee. Good, all right, good. No problems? Okay, come back right here. Like while we have you here, I'm just gonna go ahead and have you. And I want you to rotate your feet as well too. Any pain or discomfort?
No.
Flip your hands back and forth. Pain. Then I want you to close your eyes. Touch your nose here. Do the opposite side. Any problems?
No.
Okay, great. So that's good for there with the range of motion. And we're going to get the other range of motion in a second. Now I want to go ahead and listen to your heart and see if I also look at your carotid arteries to see if I hear any bruits. So I'm going to start right now. And normally when I listen, I will listen to both the diaphragm and the valve, both sides. But for the sake of this video, I'm going to do just on the diaphragm side. And as I listen, I'll have Olivia just relax. And I'm going to start right here with the aortic. And I hear just S1 and S2, no S3 or S4, no murmurs. Sounds very good. Lub-dub is what I hear. This is pulmonic right here. This right here is the herbs and tricuspid and the mitral. Now, if I was looking for the point of maximum impulse, that'll be at the 5th intercostal space going down. And I would listen for a full minute. And then at that point, it should be between 60 and 100 beats. And like I said, I will also go on the bell side too as well. But for the sake of the video, I'm not going to do the full time on the bell side. Okay. Then I will listen for any bruits. And right now, I don't feel any bruits at all whatsoever. It's nice and thrill. And I will also palpate for any carotid artery right here. And once again, that's nice and thrill +2. And no bruits at all whatsoever, which is good. Now I'll go ahead and listen to her lungs. And I want you to go ahead and sit up as well too. And you're just going to breathe for me. Sit up and breathe. Good. Again. Good. 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 That's good. Awesome. All right, now I'm going to check for a tactile firmness. And I want you to say, sit up and just say 99.
99.
99.
99. 99.
Okay. And then I'm going to check for any CVA tenderness. This is right here. Any pain or discomfort?
No.
So our CVA is negative. Now I'm already looking at her diaphragm and looking at the symmetrical. It's very symmetrical. So I've already was able to see that with Olivia. That was very symmetrical in that regard. So that's good. Both sides are symmetrical evenly, bilaterally. Now what I'm going to do also too is I'm going to check her pulse. I'm checking her radial pulse. And that's nice, and that's I hear, and that's a nice pulse here, 2+, a brachial. And we already checked the cardiac already right here. And while I'm here, I could look right here if we want to see if we see any JVP. Well, I'll look at it when I have her lay down as well. But I will check her popliteal pulse right behind the knee. And that's good bounding. Her tibial pulse right here. And her dorsal pedis as well too. For the sake of video, I'm only going to do one side. Now I will also listen to, which we're gonna do right now, is look at the, checking her bone conduction and air conduction. So by doing that, I'm going to strike this on my hand here, Olivia, and I'm first want to see if you hear the vibration on through your, how long you hear the vibration. And I'm gonna put it right here in your mastoid bone. So lift your head straight, just look straight, okay? And then you're gonna just tell me how long you feel it when you stop hearing it.
Yeah, I just stopped. Oh.
Yeah?
Just stopped, yeah.
Okay, good. That's the Ryan test. Now that means that there's more bone conduction than air. And now I'm going to strike it and put it right here, and you're going to let me know if you hear the vibration, feel the vibration both sides, okay?
Yeah, it just stopped.
It's on both sides?
Mm-hmm.
Okay, good. That's good to know. That's good. The hearing's really good. And while I do that, I'm gonna put this, strike it, and I'm gonna strike this also and put in the bony promise. I'm gonna put it here and also here. And I want you to let me know if you feel the vibrations. Just relax yourself. Okay? Feel the vibration?
Mm-hmm.
Good. I'm gonna strike it and put it right here too. Let me know if you feel the vibration.
Yeah.
Good. Good to know. All right. Now I'm going to check your pulses as well too while I have you here. Okay. And you just want to relax. Just go ahead and there we go. That's reactive right there. Good reflex. Just relax your arm. Just relax. There we go. Okay. It's one there too. Just relax your arm. There we go. Let it hang. There we go. I think we got something right there. And then relax your knee. Relax. Got a little something right there too. So your pulses are nice and +2 in that regard. Okay. Now what I'd like you to do also is I want you to go ahead and close your eyes for me. Just relax. And then what you're going to tell me if there's something is sharp or if it's dull, okay? That's what I want you to do. So what does this feel like to you?
Sharp.
Good. And what does this feel like to you?
Dull.
Okay, good. And can you tell me what this feels like to you?
Dull.
Okay, and what about this again?
Sharp.
Good. All right, great. Okay, so we're gonna get ready. Before we have you get up and sit here, are you okay? Any discomfort or any pain? Okay, so I'm gonna have you just stand up one more time. And before we get over here, I'm gonna turn this way. I want you to hold your hands out, close your eyes. Okay. Any problems or discomfort there?
No.
Okay, you can open your eyes now. Okay. All right, so I'm gonna go ahead, Olivia, and have you lay down. So now I want to check. Let me move this out the way here. Before we get started, Olivia, I want to check to see if you have any pain in appendicitis. So by doing that, I'm going to check your soleus muscle. So what I'm going to do is I'm going to have you to raise your leg up, okay? All right, and while I push it down. Any pain or discomfort there?
No.
Okay, good. Then I want you to relax. I'm going to check your McMurray muscle and see if you have any pain here. Anything?
No.
You need? Nothing?
No.
Okay, so let me go over here. This way. Any pain?
No.
Okay, that's good. All right. So now what I want to do with this right here, I'm going to go ahead and double check again. You look a little uncomfortable, but just go ahead and get comfortable. I'm going to turn your head this way and lay back. I'm trying to check to see. So I don't see any JVP, so that's good to know as well too. Okay, you can go ahead and put your head back there. And I want you just to be comfortable. What I want to do now is I want to first inspect her abdomen. So Olivia, if I may, let me just go ahead and lift your abdomen just a little bit. So I'm looking at her abdomen, it's very rounded, and I see striae, which is a little bit of stretch marks there. But in looking at it, I don't see any other scars. She has one mole, but I don't see any hernias at all whatsoever noted. So, and you don't have any pain or discomfort at all whatsoever in your abdomen at all?
No.
Okay, great. So what I'm going to go ahead and do first of all is I'm going to go ahead and I'm going to listen to her bowel sounds and see what I hear, and I will do it this way. And I'll start first with the right lower quadrant rather. And you remember listening for a full minute each time. If you don't, you would listen for longer, but her bowel sounds are active, so they're normal. So now after I've listened to her bowel sounds, now I'm going to lightly palpate. And just let me know if you have any pain. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Okay, now I'm going to do deeper ones. Pain?
No.
Kind of ticklish, huh? Pain?
No.
Pain? Pain? And now I'm going to percuss. So that looks like that's all. There's no problems at all with her abdomen at all, in her stomach. I didn't feel any large organs at all whatsoever, and no, her spleen or kidneys were not enlarged at all. So now I'm going to go also check to see if I feel any enlarged in her gallbladder. I do another test, and it's not enlarged at all whatsoever. Now what I want to do is I want to go ahead and listen to her arteries, her aortic artery. And then I'm also going to be able to listen to her renal, iliac, and femur as well too. Both on the bell, listen to on the bell side. And I'm listening to the aortic. I don't hear any bruits at all whatsoever. Now I'm listening to the renal. And once again, I don't hear any bruits. Now listen to the iliac. And now the femur. Great. Now I'm going to check your range of motion. First I would like for you to try to lift your leg straight up. Any pain? Okay, bring your leg down. Then I want you to bend your knee. I want you to bend your knee to you. Any pain?
No.
And then I'm going to try to lift you up. Pain?
No.
Okay, I want you to push up against my hand. Okay, great. And then what I want you to do is, I want you to squeeze my hand. Good. Any pain or discomfort?
No.
Okay, put your hands to yourself. Okay, I want to pull it to you. Any pain or discomfort?
No.
Great. Turn your hands this way. Push. Any pain or discomfort?
No.
Okay, great. All right, so we're going to go ahead and get up. Sit up. Can I help you up? Okay. And so I want you to bend to the side. Pain, discomfort?
No.
Bend to the other side. Okay. Turn your body this way. Pain, discomfort?
No.
Pain, other way. Okay. Pain, discomfort?
No.
Okay, great. Go and have a seat, Olivia. And lastly, like I said, I want you to rotate your feet around and pain or discomfort as well.
No.
All right. So this ends your physical exam I have with you, and it seems like your physical exam within normal limits. What I do want you to do is to follow up within 2 weeks. I want you to be able to get with a nutritional to talk about ways in we can monitor your weight and your diet so that we can go ahead and decrease that BMI. And the fact that you're starting with a new exercise program through your sports, that's going to help as well. So follow up in a couple of weeks. It will be helpful to make sure you're on track. Okay? Do you have any questions for me?
No.
No? Okay, well, thank you for coming in. All right?
Thank you.
Take care. Bye-bye.